Hello, in this video, I'm going to talk about muscles of the spine. So again, a lot of the muscles we've talked about already also affect and act on the spine. But today in this video, I'm going to talk about the remaining muscles that we haven't talked about yet. Okay, so serratus posterior inferior. Again, serratus like a serrated edge of a knife. So it has that sort of serrated edge appearance, which is where it gets that name. But this one's on the posterior side of the body and it's inferior, which is why it is named that way. So it's a very simple muscle. It goes from the spine to the posterior surface of our bottom ribs there. And so it pulls down on the ribs during forced exhalation. So it contributes to that action. Then we have serratus posterior superior, again, serrated edge on the posterior side of the body, and it's superior all the way up at the lower cervical, upper thoracic, going down to our top ribs. And it is acting to lift up, it's elevating ribs during forced inhalation. Okay, the diaphragm is our primary muscle of respiration. So its action is inhalation. When it contracts and the origin and insertion get closer together, in this case, the insertion, the central tendon right in the center of the diaphragm is being pulled down. So at rest, the diaphragm looks like this. When it contracts, it pulls down and the fibers shorten. And so when it pulls down like that in its contract state, that is inhalation. So it's pulling down to create more space in the thoracic cavity and to create a sort of vacuum in the lungs that causes air to go into the lungs. So when it contracts, its action is inhalation. When it relaxes, that allows the muscle to go back up. It puts more pressure on the thoracic cavity and more pressure in the lungs, and it causes that air to go back out, and that is exhalation. So technically, its action is inhalation. Same way, like we wouldn't say that an action of biceps brachii is extension. Its action, when it contracts and shortens, its action is flexion of the elbow. When it relaxes, it can allow the elbow to extend, but that doesn't mean it's its action when it contracts concentrically. And we'll get to what that means later on in a future lecture. Okay, so it's concentric action when it shortens, when it contracts and the muscle shortens, its action is inhalation. Exhalation occurs because the muscle relaxed. Then we have our external and internal intercostals. These are little muscles between the ribs. So both the external and internal go from one rib to the rib below it. The internal ones are deep, the external ones are more superficial. And then as we see in this picture on the right, the fibers are going in perpendicular directions. So the internal intercostals are a little bit more up and down and forward facing, and the external intercostals are a little bit more in a posterior direction, a little bit more the length of the ribs. The externals participate in inhalation. So the external intercostals, they're going more the long direction of the rib. So when they contract, it helps to sort of straighten the ribs out a little bit. It's very slight, but when they contract, it helps make more space in the thoracic cavity, which allows for more of a vacuum in the lungs and more air to fill. Compared with the internal intercostals that are going a little bit more up and down between the two ribs. So when they contract, they're pulling the ribs closer together, which compresses and makes a smaller space in the thoracic cavity, which causes more air to be pushed out in exhalation. Okay, the Erector SPINAE group, I'm only going to touch on a little bit here. We'll get into the biomechanics of this group of muscles more in future lectures. But it's a collection of muscles on all the way up and down the entire spine, from sacrum all the way to the head. So it's several different muscles that are part of this group. You'll also hear this group referred to as the paraspinal muscles. And if you've ever talked to maybe a bodybuilder or someone who's trying to increase the valley, this is frequently referred to as the valley, is where the spine is kind of the the depth of the valley, and then the erector spinae muscles are creating hills surrounding that valley. So when someone's trying to deepen the valley or work on their valley, you'll hear it called in their spine, they're trying to increase the size or definition of their erector spinae group that are surrounding the spine. So they have different actions depending on where in the spine those muscles are working. They extend the head and vertebral column. So they're going all the way up and down the whole spine, all the way up to the base of the skull, and they will cause extension all the way up and down. They also will laterally flex at whatever level we're talking about. Okay, so laterally flex the vertebral column at the lumbar, thoracic, cervical. So we get extension and lateral flexion from these muscles all the way up and down. So the origin is all the way at the base. It's the thoracolumbar aponeurosis. It's that sort of diamond-shaped sheet of fascia at the lower back and down at the sacrum, and then inserts at many different places all the way up and down the trunk and the head, depending on which muscles we're talking about and which segment. Okay, then we have quadratus lumborum. Quadratus like a square, and lumborum in the lumbar region. So there are these sort of square muscles that go between the last rib and then the transverse processes of the lumbar vertebra all the way down to the posterior iliac crest. So these are muscles that are making up a good portion of our low back. So if they act unilaterally, so only on one side, they will laterally flex the lumbar spine or laterally tilt the pelvis. Now, again, like I mentioned with other muscles, these are actually both just lateral flexion of the lumbar spine, but the difference is if the origin is going towards the insertion or the insertion is going towards the origin. So with lateral flexion, the spine is going down towards the pelvis. With lateral tilt of the pelvis is coming up towards the spine. But technically, these are both just lateral flexion, just we're specifying which direction the movement is happening. And this muscle is also nicknamed the hip hiker because when it's hypertonic on one side, it will elevate that hip or laterally tilt the pelvis. So that happens like if someone is carrying like a baby on the hip a lot, and so that hip is frequently elevated, that muscle will become hypertonic, and then that the pelvis will stay tilted that direction. Or if somebody sits on like a big fat wallet, like in their back pocket, and they're sitting on it like while they're driving or working or whatever, it'll cause the pelvis to tilt and that muscle will become chronically shortened. And then if the muscle acts bilaterally, so both sides contract at the same time, it will have the effect of extending the lumbar spine. Okay, so that is all I have for you here. I'm gonna stop recording and I'll see you for the next video.